Where's my Vaseline? I'm asking that question because what is going on right now in the name of the American people in the U.S. Senate is tantamount to being bent over and screwed. And I'm not even being kissed. What am I talking about? This crock called healthcare reform. All right, let's go back. Let's do a little bit of history, okay? When this whole thing was proposed several months ago, there was this big talk about a public option. Basically, it was a way to compete against the big healthcare insurance companies, therefore driving prices down. You had several Republicans against it because of whatever claims they wanted to make. And as time went on, several Democrats, conservative Democrats, that are against this. Okay, several months later, public option out, the idea of expanding Medicare comes in. Now, this is not a new idea. Basically, what it says is that it will let you buy into Medicare if you're under the age of 65, starting at 55. Good idea, right? Right. Because, again, there's an option for you to get subsidized health care. Now, who thought of this idea? Joe Lieberman. That's right. The same Joe Lieberman that was on the vice presidential ticket back in 2000. The same Joe Lieberman who, as early as September of this year, was still praising the idea of a Medicare expansion, a Medicare buy-in. So what happens? The other day, Joe Lieberman decides that, you know what? Nah, I can't get behind this bill because it includes a Medicare buy-in. Why did he make that decision? Well, because another senator, Senator Weiner, basically said that, yes, this is a good idea because it's one of the steps to getting a single-payer system. True. Which is basically what we all need in some way, shape, or form in the first place. So, we all know that Joe Lieberman is basically a prostitute for the healthcare industry. I mean, his wife worked on several healthcare boards, and his state is home to one of the largest healthcare insurers in the country. So now the president, in one of his pep talks to the Senate, is basically saying, we got to get this passed. We don't need this Medicare option. We don't need the buy-in. Get this passed. Okay, so here's what happens. And this is why Howard Dean is basically saying this bill must die. If you read this bill carefully, as it is, without the public option, without the buy-in to Medicare, it is a basic windfall for the insurance companies in the healthcare industry. The bill basically says that by law, you and I are going to be required to buy insurance. What the bill doesn't tell you, what they won't tell you in the Senate, is that there are no price controls, that an average family is going to be charged more for premiums. For example, the Congressional Budget Office basically said that even with the public option, even with price controls in place, it's going to cost an average middle-income family some $9,000 a year for healthcare insurance. What do you think it's going to cost you without those price controls in place, and you're not getting any more service than you get right now? And in some cases, it's going to be less. Why? Because, one, it's going to allow the insurance companies to do an end around. What does that mean? Say you have a pre-existing condition, right? Okay, they can't bar you from getting insurance because you have a pre-existing condition, but they can charge you more for it. So basically, once again, you're being bent over with no Vaseline. Now, I am going to follow in the example of several other people that have come out against this by saying, look, kill this bill. Or at the very least, veto it. Which brings me to you, Mr. President. With all due respect, where the hell are your balls? I ask that because, yeah, you're pontificating, you're giving pep talks, but there's nothing really concrete coming out of your office. You're telling these guys to get this bill done, but you're basically leading the lambs to the slaughter. What the hell is that about? Instead of being so worried about bipartisanship, get your hands on this problem. Do what's right for the American people. Politicians be damned. Midterms are coming up. If you fail on this, Mr. President, you will be the most irrelevant president before a single term is even passed. If this legislation, as it is right now, gets passed, if you do not veto this, you are done. You are lame duck before you even get started. So at the very least, you need to veto any bill that comes across your desk that has this federal mandate in it that we have to buy into a bill that is essentially a piece of crap. Senator Reid, put the health care option, the public option back in. Put the Medicare buy-in back in. Put the single payer back in. And let the Republicans worry about it. There are other ways to get this thing done. But the way you're doing it right now, no, it is not going to work. And I also urge everybody else, if this piece of garbage gets passed, do not buy health insurance as this is related to you. Yeah, you're going to get a fine, but I'm telling you, that fine will probably be a hell of a lot less than you're paying once we get done being raped by the federal government and by the insurance companies. So again, call your congressman, call your senators, call the White House. I'll provide the information here. Tell them to quit bullshitting with the American people's health. Mr. President, you had the guts to run and win. Show the guts to do what's right. Grow a pair. Do real health care reform.